For a lot of people, losing weight always seems to be a top goal. For some, weight loss surgeries offer an option that help people lose weight successfully and ward off some health concerns.
But who is that option right for? Bridget Ellison is standing by now to ask a doctor and a patient who had it done.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Weight loss surgery is not always an option for everyone, but in some cases, it can help dramatically improve your health and even help save your life. Joining me today, Dr. Harold Nera from Oviedo Medical Center and his patient, Vaughn Parker. Gentlemen, thank you for joining us.
Thank you for having us.
This is a big life-changing surgery, doctor. Tell us about what, the latest technological advances are with this type of surgery and what the choices are.
Well, you're exactly right. I mean, this is a big step for patients to take, but it's a step, that is so positive for their life. And that's the reason why I went into this field of bariatric surgery, because I saw the changes that caused in people. Everything from their medications going away, medical conditions kind of improving or even disappearing. We can improve their length of living. We can improve even sometimes. Now we can say that we can improve even the chances of them developing cancer. That's how powerful the changes are with bariatric surgery.
And so you said that now you're able to do things robotically. How has that changed, this procedure, the recovery times, the outcomes?
Technology just keeps improving our outcomes and our safety of the procedures, and that's what makes these procedures now so safe. And robotic surgery just allows us to visualize everything so up and close. It helps us identify little, details of the anatomy that we cannot see in the past. And the minimal incisions that we perform with the surgeries through are just amazing. The patients are going back to work sometimes a week after work, or sometimes 2 weeks after the surgery. They can actually
Mr.
go back.
Parker, you're his patient.
Yes, I am.
You're 100 pounds down.
Indeed.
Congratulations.
Thank you so
You had the
much.
surgery last year. Tell us a little about your journey.
Well, my journey has been very interesting. I've struggled with weight for over 17 years, and I've done the yo-yo dieting. But in 2020, my mom passed due to some comorbidities that I also inherited. So I reached a point where I realized that I needed help. I needed intervention. So I spoke with my doctor, and he referred me over to Dr. Nera and the Oviedo Medical Center. They did an exceptional job. To quote my mentor, Dr. Kenneth Howard, he said that, when we are faced with opportunities, we have to seize those opportunities. So opportunities of a lifetime must be seized within the lifetime of the opportunity, unquote. So I felt like this was the right move for me after trying everything on my own and coming to the place where I realized that I do need help. I cannot do this on my own any longer because the results are not there. So Dr. Nera and his staff was able to help me achieve my goal of being down almost 100 pounds. Not only that, to regain just the activities that I enjoyed, exercising, walking, spending time with my family, being able to lower my blood pressure and my A1C. I feel like I have a new lease on life. So I encourage people, if this is something that they've considered, if they've tried everything else and it has not worked, this may be the best option for them.
And sometimes can you qualify for, insurance coverage with something like this,
Yes.
or is it all out of pocket?
No. This is covered by insurance if you meet the criteria, which is a BMI of 35, which is body mass index, and we will calculate that for you. And you can actually calculate it yourself if you just Google online a BMI calculator. BMI of 35 with comorbidities associated with obesity, or if you have a BMI over 40, then you don't even have to have comorbidities to qualify for bariatric surgery, and it's covered for most of the insurance is covered 100%. So,
But this also entails a big lifestyle change,
It is, yeah.
and you'll testify to that as well.
mean,
and the patient
yes.
has to be committed to those changes as well.
Absolutely. I mean, Vaughn, he has been a perfect patient. I mean, he was well informed. I was honored that he chose me as his surgeon because I knew he had done the work to look up the procedures, the surgeons, make sure that they're well trained, and then he chose us to go through his journey. So, but what I tell my patients is the fight against obesity does not end the day of surgery, but it just gets a lot easier.
But it's tough at first. I mean, you can
It
only
is.
have a
This is
teeny
not the
tiny bit
easy
of
way
food
out.
at first, right?
Yes, this is
This
definitely
is-
not the easy way out. A lot of people say, "Oh, that's the easy route to take," and Vaughn can tell you, this is not the easy way out. This is definitely, surgery is surgery. It has its risks. Thankfully, we have worked hard to train and decrease those risk factors so that way we can do these surgeries without minimal risk. I mean, the risk of complications is down to single digits. I mean, 1.2, 1.3% chance of having a complication. That's the same as having your gallbladder removed. So it's like any other surgery nowadays. So it's very safe if you find the right surgeon, if you find the right team, like we have at Oviedo Medical Center. We have a great program there, so we can actually provide that service for a lot of our people. So
Awesome, awesome. And
Yes.
so what's the long term with this, as far as success rates and, maintaining the success?
So approximately 20 to 25% of the patients at 5 years are starting to regain some weight. So we have to really identify those patients early enough. And what I tell my patients is really follow up with me. As soon as you start seeing that you may be going in the wrong direction with your weight, come back and see us. We can revisit the strategies that we have for you. We follow them at least once every 6 months after surgery. So we really try to keep them engaged with our team so that way we can continue to gain. What we have to understand is that obesity is such a chemical. There's so many strong chemicals in our body that are changing with bariatric surgery. But unfortunately, your body is very strong, and those chemicals are starting to come back. So we really have to make sure that we kind of counteract those chemicals again with exercise, nutrition, and kind of all those strategies that we go through at the beginning and the end of the surgery.
All right. Well, thank you so much for coming in today and
you.
sharing the
Thank you for
story.
asking.